Hey guys, it's Dr. Emer. I want to tell you, it's been a dramatic, I would say the word is dramatic 24 hours because my patient here, who was a little bit bigger inside, size, has a thicker, wider look, and has always loved having the larger hip, larger buttock. You guys saw, I mean, I know because you commented on it, the fact that you didn't like that she had such a big buttock and that it bothered you and they thought it was unsafe for her. Listen, in my opinion, everyone nowadays is asking for their own equal rights, they're asking for their own choice, but when it comes down to letting my patient decide what is best for her, you're being hypocritical. And I actually think it's kind of funny, especially since numerous people in my industry are saying negative things about me. When I was the one that's pioneered these treatments, I taught everybody these treatments, and I have been probably the most caring and loyal and honest physician of anyone in this industry ever. And I don't do this for money or for fame. I could care less about the views. I've been shadow banned for probably 3 years on Instagram, so who knows if anyone's even seen this stuff, but I want to show you why she came to me. She came to us because her previous BBLs had irregularities, and it wasn't to increase her size, it was to improve problem areas that weren't lipoed before, like her arms, her back. If you see here, the donut area of her stomach, a hernia that she actually had on her stomach, and she's gonna have more kids, so we're waiting to do any tummy tucks and such. But also, if you take a look at the other side, I'm gonna show you guys the irregularities. Look at all the irregularities. And I know you may not like how she looks for yourself, but I am a very big advocate, especially being in the LGBT community and people choosing what's best for them. And there's nothing unsafe here. This may cause her harder ability to find a seat to sit in, but that's her own choice, right? And it's not your guys' decision to make for her. And anyone that's saying I'm unethical or unprofessional, you're completely misinformed. You do not know anything about myself then, or my practice, or what I perform. Plus, I am board certified dermatologist, and I've been doing liposuction for over 15 years. I have 2 fellowships, and I know what I'm doing when it comes to body contouring. For those that are saying that I'm not board certified, that's not true.
How extensive are pre-ops to make sure people are safe?
Very, very extensive. In fact, I make everybody go for cardiac clearances, including large examinations on the heart. And in this case, it really wasn't unsafe. It was liposuction with some fat grafting. The only thing we did differently was, if you look over here, the previous BBLs left her with major cellulite indentations and a loopiness you get to see down here on her buttock. So what we did was, and I'm gonna have you guys kind of show, just turn a little bit, we smoothened that out. Look, I'm gonna show you guys here the one side.
Turn a little bit less.
Turn a little right there. So you guys could see on that side, we evened it out so it's nice and smooth. It's harder to tell on this side because the tattoo looks over the other side.
Yeah, that's how it
Turn. And it's gonna be swollen now, and it'll come down a little bit. Turn, right there. So you guys can see, look how severe the cellulite, the indentations and such. And you know what? This is her body. It's her choice. She has support here now. Of course, we talk about diet, exercise, peptide therapies. Let me bring you back. And I want to show you just overall her arms, upper backs, all treated and looking so much better. So coming back to the middle. Yeah. So you guys, I feel like people have a freedom to choose what's important for them. And I want to say, as a physician, if I think something is unsafe for somebody, I will never perform the procedure. But this is not an unsafe thing. One of the things that we did here was really to define out her stomach, because if you look, she has tons of indentations, irregularities, and even right here, she had this looseness and a hernia that we repaired. And so all of this was done to improve numerous physicians' lipo and surgery that they didn't do correctly. And I think, to me, it's a person has a right to choose what's best for them. I do say no to many clients. And actually, my patient went to numerous doctors that said no to her. I felt we could make her improve to make her get her goals, and she was totally fine with it. And so I don't see what's a big deal about you guys worrying about how my patient loves her body, because I want to tell you right now, she's crying in happiness. She's totally safe. She's fine. The type of pre-ops we do and the surgeries we do are very, very, very detailed and very meticulous, and we do a ton of aftercare. So right now, she is getting hyperbaric, massage, IV therapies for healing, and she's gonna do great. And you know what? It's her life. And so for those out there that are saying things, I would love to know why you feel it's your business to worry about what her body is. I'm a physician who's been doing surgery for years. Of course, I do what's in the best interest of my patients. So you guys can see here her before. And again, big thing we were looking at is this area down here. And you guys can see now, much smoother transition, much flatter look. And she's very happy. She loves herself. And that's what's important. Bye, guys.